We expect to dispense valuable knowledge regarding autism from Prasad sir's experiences and thoughts to the common society. We welcome you to this series of conversations. Namaste, sir.
Namaskaram, first of all.
Sir, these days we hear a lot about autism in the social media, on the other medias, due to its increasing incidence and the trouble with its management. So what's your idea about, can you briefly explain about the autism and autism spectrum disorders?
Autism is increasing, autism spectrum disorders, increasing in its prevalence as well as incidence. And the pace with which it is increasing is quite alarming, it is quite epidemic in its proportions. So, because of this presence in the society, obviously I think the word is there more in the air than before. More and more people started talking about it. Then some sort of an awareness is getting more in recent times. That is true. I think I will not go to the very technical details of autism spectrum disorder, but briefly, it is a problem with the language skills, speech and communication that way, and the social behavior or the social skills of a child. There is a generally accepted pattern for all these things.
The norm.
The norm, yeah. So, when the child should start speaking, should develop language, and how effectively he should be using the language that he or she learned for effective communication, and how he or she should behave in a social environment, his or her interaction with the other, the fellow beings in the society, in the residential scenario, in the social scenario. So, when this is not happening, and when other causes for this thing to be absent, then definitely I think that child should be properly evaluated, properly assessed, whether this is due to this special problem called autism. So, generally I think any domestic setup where there are family members who are familiar with the growth and development of a child in the normal way, or the new word is neurotypical way, I think it is very easy to understand that this particular child is not growing or developing in the normal way, and there is no reason to skip a proper understanding of this altered behavior. So, it is increasing. There are multiple reasons, of course, which we will discuss later, and that is why, as you observed, the conversations about autism is more when compared with the previous years or previous decades. Awareness about autism is becoming more, and yes, it is there with us. It is a reality that it is there with us, and we have to learn more and more about it.
So, what does exactly that word spectrum indicates in that autism spectrum disorders? What is the range of that spectrum, sir?
As the word indicates, I think it is a spectrum. It is quite diverse, and it has got various possibilities of presentations and various gravity of presentation. So, There may be mild, moderate, severe type of classification possible. Then the issues presented by the child can be so diverse. So, two autistic kids need not be having the same grades of presentation and types of presentation. So, that is what is indicated by the word spectrum.
Sir, when we look at the cause of any disease, there should be some typical cause for every disease. So, what do you think is the cause, or what do you think is causing autism spectrum disorders? Because previously we were not much familiar with this word, and the scientific studies itself says that after 1990s, the incidence of the autism is too much, and they find the reason like the increased awareness and increased possibilities for the treatment. Is it true, or exactly the incidence is going up when compared to the previous years?
See, autism is not a fatal disease or a disorder like many other issues like say cancer or any other neurodegenerative disorders, where the fatality of the problem is very high. So, the subject who is afflicted, involved, is going to die in certain number of years or whatever it is. This is not the case with autism spectrum disorder. So, if there is a child with autism spectrum disorder with her or with him, and he is not coming out of the spectrum, he is left unattended, he is going to grow to an autistic adult. So, if there is a child today in the society as an autistic child, tomorrow or day after he is going to be an autistic adult. So, what I am trying to say is, it is not just because of the increased amount of awareness, increased amount of diagnosis that the issue is more in our present society. Because if that was the case in the previous years, previous decades or whatever it is, obviously there should be more autistic adults identified. We can't say that all the autistic children who were left undiagnosed,
Or unattended.
yeah, they passed away because of the disorder or something like that. Because basically autism is not a fatal disorder or disease which is supposed to reduce the lifespan of the individual involved. So, I should say that it is a wrong notion to say that it is just because of the increased diagnostic skills or the increased awareness that we are seeing more and more autistic kids these days or autistic adults in our society presently. The fact is their actual number is increasing. Their actual number is increasing. To be very precise, say when compared with some 10 years back or so, the diagnostic criteria has changed. So, some of the conditions which were loosely included or loosely diagnosed as autism is not coming under the purview of autism these days. Many fine tunings has happened. Some extra things are included in the spectrum. So, many things have happened. So, I think definitely what we have today is somewhat a very fine tuned diagnostic criteria and hence the numbers what we find these days is somewhat realistic. It is true that the numbers are increasing. Then you were talking about the
Causative factors.
the what causes autism? We do not have a straightforward one word answer for that question. Many postulates are there, many hypotheses behind the causation of autism. So, I am representing the Ayurvedic fraternity who is dealing with autism. So, I think I should be expressing my perspective on the causation of Ayurveda. I need not go through what is available in the internet or what is available in the Western literature. From an Ayurvedic perspective, every disorder or disease should have a cause, because the object which is under discussion is an effect.
Yes.
So, if there is an effect, there should be a cause. So, this is a very simple, quite a matter of common sense. But in real life, we may not be able to trace back to the cause of every effect.
Yes.
We can say that there should be, but that should be need not always mean that you will be able to trace it specifically and identify and reveal it, this is the cause. The same is the case with the autism spectrum disorder, like many other diseases. So, in Ayurveda we say that it can be drishtam or adrishtam. Drishtam means something which is traceable somewhat easily. Adrishtam means which is not that easy to trace back and disclose easily that this is the cause. So, according to Ayurvedic philosophical understanding, this may go beyond, backwards to the present life of the person involved. So, it may be something which he or she acquired prior to his birth. So, it may be from the intrauterine life, something which he or she acquired from the womb. Then I think what could be the reason? The environment prevailing within the maternal body, that can be contributing. Then one step further behind, the quality of the male and female contributions of conception, that may be responsible. Then some sort of unexpected changes what is happening during the life inside the womb, the emotional factors of mother,
Yes.
lifestyle of mother, the medicines that the mother might have consumed, or the lack of rest, proper rest of the mother, then overall stress level of the mother. So, there can be multiple things happening. Then factors like toxic exposures, which are so crucial in influencing the growth and developmental pattern of the baby or the child or the fetus or whatever it is. So, there can be multiple things which can predispose in the causation of autism. Then even after birth, post birth, there may be many influences. Especially in recent times, there are many important findings in this regard. See, somebody or some baby child who is predisposed to have this sort of a problem by some way or the other, which is left unidentified and which is not very easy to identify, when exposed to certain new situations, new environment after birth, I think that can be a very decisive influence to end up in the manifestation of autism spectrum disorder. In recent times, one of the major factor that way is the increased use of or exposure to screens of various types. So this is so obvious, especially after the COVID lockdowns, when exposure to screens or life online has become the normal, the new normal. And the victims on the receiving end, I think we have these kids.
Sir, so what do you suggest? Is there any age limit up to which we can completely resist the screen time, or this resistance to these such triggers? Is there any age limit? We can say that after that, okay, it's somewhat okay, like that. Is there any age limit, or it's like for such kids who are prone to have autism, who are prone to fall into autism ASD? How far the parents can take care of such things?
No, actually, see, I have to be very realistic while answering to this question, I think, because see, as I mentioned earlier, the normal has changed.
Yes, yes.
The life is so much attached or dependent upon the screens these days, of various types, gadgets, let me say, use the word gadget, yes, need not be screen alone, yes, of various types, yes, mobile phones, tablets or television or computers, laptops. See, we have n number of possibilities for exposing a developing child to these sort of gadgets. So, when the entire social life, family life, professional life is spinning around these gadgets, so how practical will it be to keep a child completely abstained from the sort of this gadget exposure? So there are questions of practicality in that issue.
Yes.
But having said that, this in no way is an excuse for exposing a child in a very tender age, in a very delicate period, to these sort of gadgets. But at the same time, we have no prior idea about whether one particular child is going to be autistic or not.
Yes.
Because see, I am seeing lots of autistic kids every week, and certain very interesting observations are there. Twin children living in the same environment, same exposure to the gadgets. One child is becoming autistic and the other is not. So, how can we say that screen made the child autistic? But at the same time, on the other side, we can see children who were growing in a normal manner, developing in a normal manner. At one point of time, due to the pressure of the situation, due to the demand of the situation, the child is getting exposed extensively to screens. Say 1.5-year-old child spending 7 to 8 hours in front of a screen and falling prey to this developmental problem called autism. So this is also we are seeing.
Yes.
So whether it is the primary cause or the precipitating cause is debatable always. But at the same time, there is no logic, there is no excuse in exposing these delicate brains to the gadgets, especially the screens, mobile, tab type of gadgets. There are many reasons for that.
Yes, yes.
I have very keenly observed what is happening to these children, and I have read extensively about the observations of many other clinicians and researchers in this regard. That is very important.
Regardless of these developments, WHO and other authorities have restricted this screen time to half an hour, like that, according to the age advances. So maybe may not be the only case is not ASD. Many other health issues will be originating from the same problem. Not only the technological advancements, but the human physiology is also affected.
Definitely. You see, overexposure to this gadgets has got many other issues which are not directly connected with the cognitive functions.
Yes.
See, the children become more and more sedentary, which is again becoming a cause for many other metabolic issues, n number of things.
Yes.
Coming to our prime area, see the age or the developmental period in which the social behavior is developing.
Very important age.
This is very crucial. At that particular junction, the child is supposed to get exposed to social environment. We always say that man is a social animal, but I think that is all based on the social exposure that the child is getting in the correct time. Otherwise, it is not going to happen.
Yes, limited to that particular instrument.
Yes. See, the behavior of a species is always defined by the way in which it is exposed. Let us think about the old character of Rudyard Kipling, that Mowgli.
Yes.
In the Jungle Book.
Yes.
Mowgli was behaving like wolves because his social exposure was with wolves
Yes.
from the beginning itself. So, even though he was a human child, he was behaving like a wolf. So, coming to human children who are socializing with gadgets, they are supposed to behave like gadgets.
Yes.
And what is the nature of the gadget? See, when I am exposing myself to the screen, I am getting n number of informations about which many parents are very proud of, which is another tragedy which I am not going to refer at this point of time. See, I am watching a cartoon, I am listening to a devotional song, I am seeing an informative educational YouTube video, blah blah blah, whatever it is. The point is, the screen is not asking me to interact with it. He is not asking me questions. He is not asking me to reciprocate.
Yes. One-sided.
So, So, this is going to be the most crucial point that the parents should be aware of. Social behavior is always based on questions and answers, demands and replies, or conversations between people or within a group. So, which is not happening when the child is continuously exposed with the gadgets. Just think about a child of 1.5 years getting exposed to a screen for 6 months, 8 months, for 6 to 8 hours per day, and regressing drastically in his social behavior, who regress to the extent that he misses all the language skills that he or she acquired, and getting diagnosed as autistic.
Sir, having said that, can I ask one or clear in one area? Can you brief much upon that typical characteristics by seeing that a parent or a person near to him can identify this kid is autistic. Is there any signs or symptoms from which we can detect the problem in the early childhood?
Definitely, there are many. There are many. See previously or even now, even by convention, I think it is a rule that the child should not be diagnosed as autistic before the age of 3. But that is need not be the case always. You can suspect, see, an autism suspect, you can use that term very early. See, at the age of 3 months, the child is not giving the type of social smile or not giving the eye to eye contact or not acknowledging the presence of parents nearby. Then see the unexplainable and unconsolable cry, then not responding to name call, or engaging in repetitive body movements or activities, or showing very limited, very restricted interests. So there are many things with which a watchful parent can identify very easily that something is there with the child which needs more observation and assessment.
Okay.
This is possible.